It's been 9 months, 2 weeks, 2 days since my gender confirming surgery, and since my last update video, there has been some things that have happened. Still haven't heard back from the doctor yet about my revision, so I'm waiting on that. And the changes that has happened since gender confirming surgery. These have filled in. It's like through here, and there's been a lot on top that's filled in, and you can see through here how that fullness is. It's like through here, definitely, and through here, it's like a big difference. It's weird because since having surgery, it feels like my estrogen, because I went and had seen the doctor, had all my levels checked and everything, and it's weird because my estrogen feels normal where it's at. Because when I had everything checked, like before surgery, when my dose was dropped to 0.2 ml, it was about 2,423 or some other weird high number like that. But when it was checked last, my estrogen was 192, so my estrogen levels are at, and that actually, it's weird because it's lower and it feels normal, and my body is still going through physical changes, so that says the higher your estrogen is doesn't mean you're going to get more changes quicker. So where it's at now is perfect, how it feels. So my weight was also checked, and I've gained weight. I'm now 133 pounds where my weight's at, so that's good. And because it's a surgery update video, also down there has changed. I've been using vibrators and a massage wand to help massage, promote blood flow, to help heal down there, and it's making the scar tissue easier to massage out. And on the right side, where the scar line is on top, where there's like where I have to put more stitches, there's been like a little nub or scar tissue there for some time, or it hasn't fully flattened out yet. And recently been using the massage wand, and that's in that spot, and it's helping to reduce it in size. So part of it has healed. I just have a small spot still there, so that's healing really well. And recently, the last week, it's like, wow, just like this last week or so, I've been noticing my labia majora, which that's the outer labia, are filling in, which has been giving me a lot of gender euphoria. It's mostly the left side that's filling in, and it's been filling in quickly since my last update video. It's like the last week, it's just like I've noticed it's the left side's filling in quickly, and if it continues to fill in like it is, that means I might not have to have that revision on that part, that fat transfer. So hoping the right side's still taking its time to fill in, but it's looking really good. It's looking more myself than it ever has. And I've gained more than I ever hoped I would. And the appearance is looking a lot better. Except I'm having an issue with the erectile tissue that surrounds the urethra. When I sit on the toilet to pee and whatnot, it tends to bulge out more, or if my legs are spread. My doctor's that when I see my doctor, that's what her concern was. I just explained to her about them having revision, and that's one of the things they're gonna fix. They're gonna tack it down. So yeah. So hopefully they can fix that, or it doesn't have this issue. But physically, it's not doing harm. But it's just more annoying because it just bulges out. So, yeah. In certain positions, which is annoying. Other than that, where I was having this stinging, that's getting better. Except that spot where the scar tissue is, on the scar line, the upper part, where they had boomer stitches. That was hurting a little bit yesterday. After pretty much was playing on a swing set, on the swing. So, yeah. Then it was hurting. But I put Neosporin on it to help heal. And that helped, so. Fun times. Just waiting for those nerves to finish healing, like the sheathing around the nerve to finish healing. Because I figured out why it was stinging so bad. On both sides, when those two nerves reconnected. One, when the nerves reconnect, the sheathing still has to regenerate around it. So until that happens, you can still experience stinging. Two, my labia majora is filling in, so it's stretching that skin, which the nerve that's going through, it's being pressed against, stretching the nerve as well, and the nerve doesn't have the sheathing. So yeah, that's pretty much from everything I've learned and from my experience. So fun times. So it's just looking amazing. And I notice the more the labia majora is filling in, the less dysphoria I'm having. Because how I was having that dysphoria, because it wasn't filled in, it's getting better to the point where because I've been when dilating, I've been looking at it a lot, especially the left side, because that's filled in more than the right side. But just giving me a sense of gender euphoria, the comfort with my body, the right signals, and the looks a lot better, and it helps with my dysphoria. And it's just a blessing to be able to have this. And it's hard to have to wait when I want it all at once to be there. But it is what it is, and I will get there. I'm just hoping the right side starts to fill in quickly and it fully fills in, because if it fully fills in before my revision, whenever that happens, it might not have to have the fat transfer done. So that's the biggest so far of that achievement recently. Gained towards. And the way it came seems to be helping filling that in. And my breasts and my butt as well looks a lot better with the shape and fullness. And the next thing I've been really happy about, even though I haven't had drainage for a while and I'm still using pads and liners, recently I stopped using pads and liners and just wearing underwear. And I've noticed a few things. Wearing the underwear just feels better. And it's giving that sense of gender euphoria, the way it feels, not having those urinary issues like I was, and just being able to feel the underwear just against my body normally. And I've noticed, because I'm keeping track of the health of my body. It's like whenever I was using the bathroom, I was checking, and I've noticed on the underwear, right where the vaginal entrance is, that spot on the underwear, there's been times where it was been wet more than other times. Like sometimes it's been more wet, and sometimes it's been less wet in that area. I've noticed the days where I had drinking more water and hydrated, it's been a little more wet in that spot than the days I haven't had enough water. So that tells me that my body's creating that like the vaginal fluids. It's more like moistened skin, but those fluids that naturally help clean everything. But it's not quite like cisgender women where it flushes everything out, but it's enough to make that part of my underwear wet, where when I seen that, it was giving me a lot of gender euphoria, because that's something I didn't think I would have that much wetness and like that much moisture. So that's something I'm happy about. I'm just hoping that I'm able to, when sexually aroused, or it soaks my panties, or just have enough fluids, so or to have to use a little bit less lubricant when dilating and whatnot. But see how things go with time. And yeah, so that's pretty much what's happening since my last update video, so my surgery update video. So everything's going good, looking good, and a lot better, and feels better. The mind-body connection's a lot better. So until my next video, please comment, rate, and subscribe. Until then, boo!